Hello and welcome to the Journal. I'm Steve Kendall. When it comes to health issues, the coronavirus has obviously dominated the news this past year, and it appears it will continue to impact us into 2021. Joining us to talk about that and some other public health issues that we still need to be aware of and prepared for is the Commissioner of the Wood County Health Department, Ben Robison. Welcome to the Journal, Mr. Robison. Appreciate you being here.
Thank you. Good morning. It's a privilege to be here.
Yeah. And as I mentioned in the just a moment ago, obviously coronavirus is still top of mind for us, and it's going to be for some time. As we sit down on this day and talk about this, and it's an ever-changing, changes seems minute by minute, hour by hour. Where are we kind of right now in Wood County and just generally overall in terms of how we're dealing with coronavirus? And of course, obviously the governor's weighed in again recently, but let's talk about Wood County and just the immediate area and what's going on with us in terms of how things are going at this point.
Yeah, thanks. As you know, every Thursday, the governor releases the updated public health advisory system, and they include among the other things that they list the color of the counties as well as the cases per 100,000. So this last week, Wood County, for the first time in a while, has returned to red. And people may wonder what that means. Well, what it means is that we are now seeing impacts in our healthcare system. That means that increases in COVID cases could have broader impacts on healthcare delivery should we have a surge in cases that require treatment. And so that's what turned us from orange to red this week, was actually increase in outpatient cases for COVID-like symptoms. And because of that, we are now moving from orange to red. The risk for getting the disease is related to the incidence rate, which has been high for a number of weeks. The change in red just reflects the other side of the equation, which is the severity of the impact. And so we've been saying for a long time that the longer the cases are high and the higher they are, the greater the risk to individuals who are more vulnerable to adverse outcomes from COVID. And we're concerned that with us turning red, we could see more of that in the near future. To those numbers, as I mentioned, we are now at 385 cases per 100,000. That's nearly 4 times the CDC's threshold for high incidence, which is 100 cases per 100,000. And just as a way of benchmarking, if we go back a month in time, those numbers would have put us 50 higher than the highest rates within the state. But right now, based on how many cases we're seeing across the state, it puts us only ranked 55th in the state in terms of cases per 100,000. So pretty substantial surge in cases across the state, and certainly we're seeing it here in Wood County as well.
Now, one of the things that we hear nationally is the concern about the dominant things that will start to happen, the dominoes that begin to fall when ICUs begin to fill up and hospitals become overwhelmed, that sort of thing. What's our status right now within Wood County, where we obviously have a hospital in Bowling Green, Wood County Hospital? How is that tracking for us locally?
Yeah, fortunately, we haven't had the same impacts on our ICU and our hospitalizations that other counties have had. I know that last week Wood County was actually able to receive COVID patients from outlying areas to provide assistance and decompression of those systems outside of Wood County. Wood County Hospital is consistently managing and monitoring their numbers to make sure that although they want to be a resource within the broader hospital network, to also ensure that we have capacity that remains available for the residents here in Wood County. So they're doing a really good job. As of right now, that's not something that we've seen, but the more cases we have, and as we get to see that in other places, we have to recognize that there can be indirect impacts here in Wood County as well, as hospitals really do work together. And if one area is surged, it could eventually lead to other parts of the state. And then the few cases we might have could be the straw that broke the camel's back, if you will, if we're having to provide support from county to county.
All right. Now, when you talk about, obviously we're looking at Wood County, we're looking at Northwest Ohio. Are you in touch on a regular basis with your colleagues in the other counties in the state? Because obviously health commissioners around the state in the 88 counties are all dealing with this to one degree or another. So how do you go about sharing information and just sort of keeping kind of ear to the ground on what's going on around the rest of the state?
Yeah, absolutely. We have regular touch points throughout the week. So there are, I'm participating in a couple of standing meetings that happen with the broader membership. We have a weekly meeting with all of the member health departments through the Association of Ohio Health Commissioners, or more commonly known as AOHC. So we meet on a weekly basis. We also, all of us have a weekly standing meeting with the Ohio Department of Health, where we talk through the issues related to COVID, as well as a standing meeting with the governor every Monday morning, where we talk about the things we're seeing there. So all three of these give us an opportunity across the state to see what's happening. We also have more meetings within the Northwest region. So we have a standing weekly meeting here in Northwest Ohio, as well as with what we call the six-pack, so the counties that we work with most closely, as well as the broader Northwest region that we meet on a more regular basis as well, to make sure that we are hearing what everybody's doing and making sure we're collaborating across all these various efforts, from cases to communication to vaccine planning.
Now, across these different areas, and even Wood County, we have several cities, but we also have basically a large rural area, and obviously scattered through all of those are different sized school systems. How is that being managed? Because we know that sometimes schools that are more urban in nature, or city schools versus rural schools, have been dealing with this in different ways. How does your agency, how do you become involved in helping them make determinations about whether to go to a certain kind of schedule, or have people in the classroom or not, or have hybrid learning packages? What's your role in that?
Yeah, thank you. We've been working with all of our school districts and our private schools since the outset of the pandemic to do a couple of things. One is to provide guidance to that broader question of should we be in school or not? What should our delivery system look like? And certainly as we've moved through this pandemic, going from the cancellation of schools all the way back in the spring, then to resumption of school once we came back to the new school year, there's been a lot of engagement even before my time here with Wood County Health Department. But we also worked with our schools once we came back to train up members of their team to support contact tracing. And so they are actually some of the frontline workers who are helping us to identify cases and contacts to ensure that the schools are remaining healthy. And we advise them and work with them closely to make sure that they're following the guidance. And if there are any changes in that guidance, that we can help to address that expeditiously. We also, as things happen, you can imagine that I receive a number of phone calls from all of the various school administrations that are supporting delivery of education. And what I can tell you is that across the board, what we have seen consistently in our schools is that they may be impacted by COVID because of cases they've acquired outside of the school environment, but we're not seeing additional cases identified because of contacts within the school environment. So we definitely do identify cases among schools or among students and among teachers. Those are reported each week, as you know, on Wednesdays here in Wood County, and then on Thursdays across the state. But what we find is that although those cases are identified and we quarantine their contacts, very rarely, with just few exceptions, do those contacts develop illness due to those in education or in classroom or in activity exposures related to the school. So we think this is reflective of the consistent application of guidelines here in Wood County. We are really fortunate that our schools have been so committed to this and have invested such time and effort to make this work well. And to be honest with you, we're hearing the same thing across the state. So what we hear from our colleagues is the same thing. The only time that we hear that schools are really driving cases is when they are not applying those guidelines consistently. In those cases, then we do identify cases in the classroom, but when they apply those guidelines consistently, we don't. But the challenge for the schools is, as these cases increase, the risk for them is that they could have so many impacts either to their student body or to the educators and the staff that support education that they may need to reconsider the way that they're delivering it. Just for some simple numbers for you, we looked at our total cases from March until October, the end of October, and from the very beginning of the pandemic until October, among school-age kids, so these are kids aged 5 to 18, we had 189 total cases among school-age kids. These were anyone, whether they were in school or not, who got sick during those times. So that includes the summer, includes the time that schools were closed. If you take the next 2 weeks, we went from 189 cases to 323 cases just in 2 weeks among those same ages. And in fact, for our older kids, we look at our 18-year-olds who are, after we've removed those students that we know are BGSU students, we went from 41 cases to 124 cases in just those 2 weeks. 67%, in other words, of all the cases we've seen among that age group happened in just those 2 weeks. So we certainly are seeing some substantial impacts, and those are leading schools to have to decide, can we deliver education this way or do we need to reconsider our model for the time being because of impacts?
All right. Now, when we come back, let's talk a little bit about, kind of clarify again for people, because there obviously are all kinds of bits of information about from demographic, from an age point of view, who's more affected, who isn't. We come back, let's see if we can maybe get rid of some of those myths about who is more impacted and who isn't, because that seems to be out there just on a daily basis as to why certain groups can do certain things and other ones can't, and why certain applications in terms of masks or something aren't important or are important, and you get just a mishmash of information out there. So we come back, we'll talk a little bit about that. Back in just a moment with the Commissioner of the Wood County Health Department, Ben Robison, here on The Journal. Thank you for staying with us here on The Journal. Our guest is the Commissioner of the Wood County Health Department, Ben Robison. One of the things that seems to confuse people, or it seems to be an ongoing issue of confusion, is just who is more vulnerable, because obviously you talked about school-age children, college-age kids, that sort of thing, and I think there's some confusion about, yes, there's been some growth in the number of incidents among those groups, but what does that really mean to the rest of the population, and who is still the most vulnerable in this? But that shouldn't mean, though, that we disregard the other populations that are less vulnerable. Is that correct?
That's correct. So, although anyone can spread this disease, what we are aware of is that some people are at greater risk for adverse outcomes from this disease.
Okay.
And so that's something that we've been talking about a lot, that people have asked me almost since I arrived here in Wood County on September 2nd, what does it mean if we go red? And what I've been saying all along is really what it means is that now people who are at greater risk for adverse outcomes are now getting sick. We've been fortunate that up until now, many of our cases have been among individuals who just haven't needed additional medical care to recover. Okay. And so that's the concern, is that, you may yourself say, I don't have particular risk. I don't need to worry about this. But the challenge is that if we limit ourselves to just what is impactful for me, we could potentially transmit it to individuals within our community that we care about, our neighbors, our family members, our loved ones that could have those outcomes. So you might be wondering, what is it that leads to these severe outcomes? And it's the sort of things that you would imagine would do that. And so it's things that can impact your ability to fight off infections. So things like cancer, having heart conditions is something we've identified. Certainly respiratory conditions, including COPD and asthma, are of concern. Obesity is a concern, as are other things related to liver disease and blood pressure. Smoking is always a major risk factor if you have that. And diabetes also has been found to be related to more adverse outcomes related to COVID. And so there are a number of people, and what I just indicated there is a pretty substantial number of the population. When we did our evaluation of those conditions here in Wood County, we found that about 45% of the population here in Wood County has one of the indicators that could lead to adverse outcomes from COVID. And although the more you have, it makes your risk higher, we have 45% of our population that is at least at risk for more severe outcomes from COVID than maybe the other 55% of the population is. So this is not something that is just a minority need among just a few percent of our population. And we also know that people who are older are at risk for more adverse outcomes. And about 25% of the population here in Wood County is 65 years of age or older. So we value all aspects of our community, and I know that all of our residents here do too. So taking those steps helps them to protect the people that they care about, who may be in a different situation risk-wise than they are.
Because one of the things you hear, again, it's a small part of the population, but to some degree is, well, if you're in one of the vulnerable or at-risk categories, you just stay away from everybody, but let the rest of us go about our daily lives. And what you're saying is that isn't a recipe for a good solution to this issue then. It isn't, but because people are saying, well, if you're vulnerable, then take care of yourself, but leave me out of this. And that's not going to work, is it?
It isn't. And in fact, we talk about this term community transmission that you're hearing maybe thrown around. What that essentially means is that you don't know where you got it when you get it. So early on in the pandemic, we were able to trace it back, and we could say, okay, this case had contact with this person, that person developed disease and infected this other person over here, and we could see that line. Now, what's happening now is, and we know this from our case investigations, when we call people who are positive, they say to us, we really don't know how we got sick. We aren't really going anywhere. We just go to the store, pick up groceries. We've been really limited. We might see one member of our family, but they didn't have symptoms. And so community transmission really means we don't know where we got it. The other thing to remember too is a good proportion of individuals can be asymptomatic or pre-symptomatic. And even if you do develop illness later on, you can be contagious for up to 48 hours before those symptoms onset. So if you're going about your life saying to yourself, well, I'm going to really just isolate myself when I'm sick, and that's how I'll keep the community safe, so I don't need to take precautions until I'm ill. The reality is you could be exposing people without any knowledge of doing that, even though you're intending to be responsible. That's why we have to act at any given time that we ourselves could be contagious, as well as anyone around us could be contagious. Because if we take that approach and really treat it with that level of seriousness, it positions us to have a mentality that embraces the guidelines that do stop the spread of COVID and helps us to embrace them, I think, more consistently than if we assume it's just an every once in a while problem.
Right. Yeah, and it's a good point, because if we instead of being reactive to it, in essence, be proactive about doing it and saying, look, before I think I might be contagious, I should treat myself as if I am all the time, and therefore, and if everyone would do that, we'd have a much better, maybe quicker outcome of this than we currently have. Yeah,
that's correct, and that is what has made COVID so challenging. So the virus that causes COVID is called SARS-CoV-2.
Right.
That designation means it's closely linked to the virus that causes SARS. But unlike SARS, COVID has this asymptomatic transmission risk. And where SARS was able to be shut down with traditional public health measures, COVID has not been because of asymptomatic transmission. Based on a study that the state of Ohio did over the summer, they found that our incidence rate, or the cases we know about, and what its relationship to the prevalence rate is about a 3.5 times difference. So if you take the total incidence you have and multiply by 3.5, and that is an estimate of what your prevalence is in your community. So given Wood County's numbers right now, we are basically saying that about 1.3% of the population in Wood County could be positive for COVID, whether or not they know it. That's a pretty substantial number. I mean, we're getting somewhere to around about one in every 75 people could have COVID, whether or not they know it, based on that study. So it is an estimate, right? There's no way for me to be able to say these are the 1 in 75 people across all groups, but it's something to be aware of, that this is certainly more significant than it has been as we move to higher levels of cases in the county.
Yeah, and it puts it in perspective that people can get a feel for, because it is a case, if you think about that, well, I'm in a room or I'm around 100 people, that theoretically means that at least one of us, and maybe more, just on that average, based on that, that makes you think about it in a little different perspective versus, well, I'm not around anybody who acts like they're sick, and therefore no problem here. Now, I know we've got the holidays coming up, and I know that you folks are working on, you have some special things where people can kind of gauge how to go about their holiday plans, get-togethers, all of those things that we like to do between now and December 31st. So when we come back, let's talk about the health department's initiatives in those areas, and we'll maybe touch on a couple of other things, other health issues that are out there that we don't want to forget about while we're busy fighting COVID-19. Back in a moment with Ben Robison, the Commissioner of the Wood County Health Department, here on The Journal. You're here on The Journal on WBGU-PBS, and our guest is the Commissioner of the Wood County Health Department, Ben Robison. As we were leaving that last segment, obviously we're coming up on the holidays, and probably none of us back in March, April, May ever thought we'd be talking about how are we going to handle the holidays when it comes to this particular health issue, the coronavirus. I know that your department has been working on some ways that people can figure out how to plan these events, still have them, but have them in a safe fashion that will help us get through this holiday season, which of course has the potential to create another large surge of this if we're not careful.
Yeah, you're right about that. We are always concerned that we can see a bump in the 2 to 3 weeks in particular following a holiday. So coming into the fall holiday season, going from Halloween to Thanksgiving to Christmas and New Year's, it's a series of holidays that are spaced almost perfectly if you're trying to create a significant number of cases for a pandemic. And so this year we have to take some additional steps to keep ourselves safe. To help people to do that, we have created a self-scoring quiz that allows you to answer questions about what your Thanksgiving plans will be like. And so you get to ask about who's attending, or answer about who's attending, questions about how you plan to do seating and serve food. We ask about things like distancing, if you have people outside your household that are joining you, as well as things you may not be thinking about, like how you greet each other and say goodbye and what you do with bathrooms. So we've tried to find a way to make it interactive and fun. We hope that you feel free to take it multiple times. You can just put, there's no information being collected. It's just for you to answer on your own. So take it as many times as you want. And you know, we hope you share it with friends and family. And you can find this on our webpage. And if you just navigate to our webpage, you'll be able to find the location of this survey. And then from there, take it as much as you like. And at the end of the survey, you'll get to see the feedback on your score. And you can go down and see which questions cost you the most points. And so the more points you lost in a question, the more important it is to try to make that score higher for that particular issue.
Yeah, because the one thing we don't want to have happen, obviously, and no one does, is to have someone contract this from what's supposed to be a celebratory event, a happy time, and yet have someone or a number of people come away from one of these contracting the virus and either having an extremely difficult recovery or something even worse than that. So it's obvious, again, as we've talked about, looking ahead versus reacting to it after the fact. Along with some of the other things, and we've talked about COVID, is there anything else that we haven't touched on with COVID that you want to talk about briefly?
Well, and I think something to note too, COVID has substantial impacts outside of just the disease itself. And so we certainly are seeing particular challenges with regard to mental health needs right now. One of the areas that we're seeing those impacts is in our combating of opioid addiction and opioid overdoses. Right now, we've seen actually about double the number of overdoses that we were seeing this time last year. And so as a lot of this is kind of this combination of people being laid off of work and being home and dealing with the depression and the needs that come with COVID and resorting to things that they are still battling. And so there's a great program in place, the Quick Response Team that's through the ARC Committee here in Wood County that works to follow up with individuals who have had an overdose experience. To date, we're tracking that we have at least a dozen deaths that we estimate from opioids, which is an increase for us. And we may even have more as we go through the year and we're able to see what additional data comes in. So these are really trying times. And you know, it's worth noting that here at the health department, we have a community health center that has a medication assisted treatment center that people can enroll in. We have a peer counselor who provides support, as well as a social worker who can connect people to services. And we actually just, our Board of Health just approved the purchase of about 500, or excuse me, a purchase of about 50 bridge devices that will help to provide non-medication assisted pain support for individuals who are coming out of addiction. So this is a broad-based challenge. We're really fortunate that here in Wood County that we are connecting all of the partners to embrace the public health aspects as well as the other aspects of treating addiction. But we certainly are seeing the impacts from that here during the COVID pandemic.
Right. And those are some of the things I said that sort of have flown underneath this because the news is dominated by COVID and coronavirus, and some of those sort of rippling issues don't get as much attention as they could or should, and they're still there. We know that we still have an opioid situation regardless of coronavirus, but it's sort of taken a back seat a little bit because of this. The other thing coming up as we move into the colder weather now, obviously typically at this time of year in a normal year, we'd be worried about flu and how to deal with that and making sure people got vaccinated. Where are we with that right now? Because obviously flu has not taken hold yet, and maybe we'll have a non-flu season maybe, I don't know. But talk a little bit about that for us. We've got just a couple of minutes here.
Yeah, we hope that our experience with influenza is what we saw in the Southern Hemisphere. Southern Hemisphere can often be a predictor of what we might see, and they had a light flu season. But it will depend upon how well we apply these COVID guidelines, because interestingly, the things that keep us safe from COVID also keep us safe from influenza. So, but what we have with influenza that we don't have with COVID, at least as of today, is an effective vaccine. And so if you have not yet been vaccinated, you can go to vaccinefinder.org. This is a site that suppliers of vaccine put up their times and availability in. You can identify what vaccine you're looking for. You can find a location near you where you can be vaccinated. That is the best tool to keep yourself safe from influenza. It helps us to not only limit the impact on our hospitals potentially or on your workday, so you don't have to stay home, but during this time when influenza looks a lot like COVID, it can help to keep things less complicated because you won't have to wonder if it's flu or COVID, and you may be able to avoid situations where if it's caused by flu, you may not know that at first. So this can make our lives a bit less complicated during a COVID season, and so for a lot of reasons, we're encouraging people to get their flu vaccines.
Yeah. And the good news is if people have questions about that, or as you talked about, dealing with addiction, dealing with COVID, they can contact the Wood County Health Department, and there will be someone there who can answer their questions or direct them to people who can help them with whatever concern they particularly have, and that's a good thing to know as well.
Absolutely. There are great resources on our webpage, as well as the state's webpage for coronavirus, as well as the CDC. So I encourage you to become familiar with these resources. We would direct you to places like this as opposed to Facebook to find your health facts. Not only will it be more comprehensive, but it's going to give you some really good evidence-informed recommendations to keep yourself safe.
Great. Well, Ben Robison, Commissioner of the Wood County Health Department, thank you so much. A lot of good information. We'll touch base with you downstream a little bit on this and see where we are, not just with COVID, but any other public health issues that we might be confronted with. So we appreciate you taking the time to talk with us today here on The Journal. Thank you.
Thank you.
And you can check us out at WBGU.org, and of course you can catch us on The Journal every Thursday night at 8 o'clock here on WBGU PBS. We'll see you again next time on The Journal.